of the Wellness Wednesday. We're going to have a great conversation, and we actually have another doctor coming in to join us. Now, doctors are notorious for having their schedules filled up at the last minute, so I hope Dr. Leo can join us. Dr. Leo, just a little bit about who he is and why we asked him to come here. And I hope he's able to make it. Otherwise, we will absolutely have him again on a different day. But I do hope that he does arrive in the near future. He is my physician. He is an absolute he is an absolute expert on oncology, hematology oncology. And he has treated a number of my patients in the clinic. And whenever I have a complication, whether it's cancer or whether it's something to do with the blood, or even if it's just a very difficult metabolic or otherwise condition that requires some better or more in-depth, let's see if this will improve the quality of the sound. Maybe, yeah. You need to work with the qualified people, and when you work with the people who know what they're doing, it makes all the difference in the world. All the difference in the world. Now, and at some point we'll talk about some of our personal stories. And the other thing is, again, there's a general formula that just basically tell the folks what you want to talk about. Rachel is also here for a purpose, and thank you for being here.
Yeah. Keep you guys on track. But
Keep us on track.
We could kind of just back up because you guys are going to get into the nitty gritty. But we could talk about it on a really basic cellular level.
And there's a man himself.
Hi. I will actually.
Actually, we're live, doc, so please sit down and jump in. We were just talking about how notorious doctor schedules are for being. If you can come in a little closer here, we can make.
I don't know if I can.
Oh, okay. Yeah,
Make it cozy.
Wonderful.
Sorry for being late. Got tied up.
Well, it's a good. You are a doctor. Hello, my friend. How are you? So that's actually perfect. Great timing. We did a brief introduction about, especially that the topic is, the health, wellness, and this is a special guest appearance by Dr. Leo. So let's talk about you in terms of your background, your history, and now you come from Siberia.
That's right. Thank you for asking, Sergey. And nice meeting you, Rachel.
Yeah, nice meeting you too, Dr. Leo.
Yes, back in '96, I was very fortunate to come to the United States as an exchange student. That was Rochester, New York. And winter in Rochester felt like spring in Siberia. So I decided to relocate. And eventually came to this country permanently in '99 and did all of my training, 3 years of internal medicine and then 3 years in oncology there in Rochester, New York. And has been in Missouri since 2005.
Oh, God, that's fantastic. Actually, let's move the mic just a little bit more to the side, Doc, so that we can we're not covering you. And so the one thing is I want to talk about. Now, you weren't always an oncology doctor. You had other interests before as well. So you had many hats prior to this. Let's talk about your journey, and let's talk about where you come from professionally.
Yeah. Thank you, Sergey. While in medical school, I was really interested in rheumatology and cardiology, but then was drawn to cancer after doing couple months of oncology, hematology training in Rochester in '96. At that time, I realized that cancer is something that, first of all, is extremely important for patients, for ourselves, to cure patients. And second, it's such a rapidly advancing area that today we are able to do many things that we were not able to do a year ago. And certainly, we've come really long way compared with 10, 15 years ago.
And I want to talk about that. And again, it's we only have an hour, and this 1 hour we can only cover so much, but we'll have you back again. Let's so you are one thing that I really appreciate you, and you can miss a very wonderful brief introduction, very brief although, about Well, I literally built you up, and this is in my mind. This is actually it's a true statement. When I have a difficult situation, whether it's an internal medicine or just complicated on a conventional scale, in other words, or if there's any kind of well, let's say blood related, if there's any question of cancer, if there's any question of that there's going to be more help or more options. And most people don't realize that well, oncology is not just about well, when I was going through my episode in 2007, just a little brief aside, I went through a stage 3 GI, gastrointestinal, and so colon stage 3 is I was given 2 years to live, literally 2 years to live. And the one thing that I noticed is that we do this as doctors. There's positive placebo and negative placebo. Now, you have to be honest. You have to say the truth. If something doesn't look good or prognosis not so good, we have to put it in perspective. But at the same time, the way we phrase it as doctors, now I was a patient, is if I'm going to be dead in 2 years, well, what does it all mean? That's what put me into holistic track, and I'm still here in remission for the rest of my life, I hope. Please, yeah.
Right. You're right. It's not just cancer that we have to focus on with great precision, but also patient as a whole. And there are many aspects to what patients need. One of them, of course, as you mentioned, is psychological aspect, dealing with trauma, being diagnosed with cancer, and uncertainty about life expectancy. In addition to that, if we focus just on treating cancer alone, many things could be forgotten and unaddressed, and that is going to affect final outcome. I'll give you an example, and that's something that relates to all of us, patients and doctors alike. Diet, and Rachel, of course, right? Since Rachel, you're a nutritionist, right? Diet actually plays a crucial role in curing cancer, especially whenever we use immune therapy. And we could talk about specific examples, but most importantly, I just wanted to say that from the patient's point of view, of course, it would be perfect to address cancer treatment, but addressing just this aspect is unlikely to give us the same results if we address everything. From nutrition and physical activity to other aspects of person's well-being that Sergey deals with.
Yes, thank you. And I will jump in as this is what I learned. We have many patients together in common. Actually, I referred to you,
quite a few patients. Yes,
quite a few, as a matter of fact, including yesterday. It was and thank you for getting people in, because I know your wait list is tremendous.
And how long have you guys, since I've been in the space, you've been working together, but what's the history as far as how long?
7 years, isn't it?
Yeah, that time, right?
Actually, the introduction, let's kind of go back to beginning, because the introduction is that this wonderful man sitting right here across from me here is, I learned about you from Dr. Shealy, and literally you are the only oncology hematology doctor that Dr. Shealy trusts in the world. And that's a big title.
That is a big title. And it seems like you have some other accolades too, because I'm looking at this and you've got some other like top doctor things.
It's not a big deal, Rachel.
Oh no, let's talk about it.
No,
yeah. Let's see. What does it say? It says 417 magazine, top doctors, hematology, oncology from 2006 until the present. We're going to call it a big deal. And then you've got a whole bunch of other certifications, of course. And oh man, I mean, the list is good. We'll put it up here somewhere so people can see it. Yeah.
Thank you, Rachel.
Yeah.
I want to, your mind, your knowledge is so much in depth and it's so brilliant. I'd like to just mention and have you talk for just as long as you can, you'd like to. Let's talk about advancements and things that people don't know about oncology, that they should know, because here's where I'm coming from. When people come to me and they say, doctor, I have cancer, and usually the holistic approach is nutrition, stress solutions, supplements, IVs. We'll talk about that, intravenous ozone, intravenous vitamin C. And again, we work together collaboratively on all these things. And then, of course, mental, emotional, and then, of course, the other modalities and working with the rest of the body, working with the rest of the patterns. Getting Rachel involved, that's a must because, again, you got to have the basics solid. But some people tell me, I don't even want to consider conventional. They're going to kill me. And they have stories. They have my mother, my father, my brother, again, there's all this bad outcomes. And what I say is keep all options on the table. Keep every option on the table. So let's talk about some of the options that people don't know about, because it's not just about chemo and radiation anymore. There's a lot more.
Absolutely. Thank you for bringing that up. Of course, there has been a true revolution, and not just one revolution, but several revolutions and advances in cancer management. Number one, probably most important from my point of view, is immune therapy. I'll just start with a story, or I'll share with you a story of one of our patients, young guy in his 40s, came to us in 2017. That was approximately 6 years after we first started using immune therapy in the treatment for several cancers. And when we started using combination immune therapy for metastatic melanoma, it might have been a year or two at that time. This young guy, he's a programmer. He was very fit. At one point, he even tried or even participated in one of the major football teams in Chicago. So very fit, very smart guy. And over the preceding 2 months before coming to me, he developed left arm weakness, left leg weakness, and started having problems doing his job, his tough job as a programmer. So eventually he was diagnosed with metastatic melanoma. Metastatic not just to his brain, but also to his spine. The way we knew that, he was in terrible pain because of the pain in his spine. And of course, he had stroke-like symptoms with weakness on the left side. So what did we do? We gave him immune therapy. Chemotherapy does not even work for metastatic melanoma, but immune therapy makes such a huge difference. On average, what numbers tell us, and of course, patients are not numbers, but it's important to share this information. 60% of patients with some certain types of metastatic melanoma are alive and well many years down the road. As of right now, it's 7 years and counting since the study was completed. So, and for our patient, we started him on immune therapy. He started bouncing back up very, very quickly. It was back in 2017. He went into remission about 2 years later. Immune therapy is not exactly like chemotherapy or other types of treatments. It did take some time in his case. Initially, he had marked improvement within the first 2 months, and then gradually, slowly but surely, the remaining spots of the disease were going away. So, and now in 2023, he comes happy. We see each other once a month. He also had significant psoriasis, which sometimes could flare up with immune therapy. But we designed and gave him the treatment that on one hand controls psoriasis, on the other hand, the same treatment might be helping immune therapy to work more efficiently. So now he tells me, Doc, I am feeling better than ever in my life, and I'm very productive in my work. He doesn't only program himself, he manages a group of people, maybe 20 people who work in the same field. So one of those amazing stories that we are very fortunate to see several patients a day like that.
So now, over your lifetime, how many stories like that have you come across?
Well, quite a few. Of course, on a daily basis, we do see patients. For example, yesterday, I saw the patient who was diagnosed with lung cancer, deadly disease. Before introduction of immune therapy, survival on average was about 1 year. Now, this patient was diagnosed back in 2018. We treated her actually at that time. The best approach was combination of chemo and immunotherapy. More recently, most of our newly diagnosed patients with metastatic lung cancer get just immunotherapy alone. But at that time, she received combination of immunotherapy and chemotherapy. What did this patient have? She had lung cancer that traveled to her brain. She presented with brain metastasis and with seizures and with stroke-like symptoms. If you ask anyone, what are the odds that patient with brain mets and lung cancer would be alive 6 months down the road or even a year down the road?
Oh, God.
Yes. Most people would not believe that. But now in 2023, she is alive and well. She has been off all of the treatments for the past 3 years, and her disease continues to stay in remission, because that's the power of immune system. We just need to give it a nudge initially, and then it keeps working.
My God, God bless. Rachel, feel free to jump in at any time.
Well, I'd just be curious
God.
when you,
Yeah.
so like this immune therapy or when you're doing
Yeah.
it with the chemo, like how does that translate to how when you guys work together? Like
Let
where
me-
does that?
Wonderful, wonderful, wonderful. This is what I want to say, and I just want to present something to you. Again, I'm not saying a name, but this is one of the highlights of my career. In other words, and there's many examples I can say, but again, I will never say as a holistic doc that I cure anything, especially cancer. Just for the record, I do not cure cancer, period. But we work with the immune system, and we work with doctors such as Dr. Leo, which is fantastic. On our end, what do we do? Let me describe our approach, our concept. And at some point, I'm going to have Rachel jump in because there's a lot more detail to it than meets the eye. But I just want to just draw a general big umbrella of what it is all about. Holistic. When I see people who come to me who just say, their concern or diagnosis, whether it's stage 1 to stage 4 cancer, or it could be different cancers, could be brain, could be breast, could be gastrointestinal, could be prostate. There's various different things. Now, of course, it's different stages, different treatments. The basics are the same. What do you need in order to have a good outcome, or at the very least, a best outcome possible? Lifestyle, and the basics. Nutrition, garbage in, garbage out. If you feed sugar, if you feed the processed, if we continue doing the same pattern that has caused the same process, question is, why did the process begin? It's a metabolic process. It's an issue. Would you agree that it's cancer is a metabolic, at least partially?
Right. In many cases, we know that at least more than 30 cancers are related to being either overweight or having problems with metabolism. Absolutely.
So this is 100% where I say to every person who comes in with either cancer or any kind of metabolic condition that Rachel and I have to work together side by side. Because I'm going to have you jump in on this.
Yeah, no, I mean, and we could, and this is probably something you would be
Please.
able to explain or know better than I do, but I have the basic concept that I think people need to know, and that's about like angiogenesis and
Please.
eating foods that, so let me back up so people know what we're talking about.
Mhm.
So that is essentially creating growth of capillaries and things to feed, like if you have a tumor, it needs blood to be fed. And certain foods can make sure that the things that get fed should be fed and the things that shouldn't be fed don't get fed. So I guess kind of anti-angiogenesis is, and so that very, very often is a dietary. We can start there. I'm not saying it's the only thing by any means, because there's so much more, but this is why nutrition becomes such an integral part of it.
But not just nutrition, because activity,
Sure,
lifestyle.
exercise. Well, right, because you just
Yeah.
said like obesity is a huge.
Absolutely, weight, body
Mhm.
mass index. Actually, a huge correlation of weight, overweight, with cancers, and a lot of it actually. And we can get into the hormones at some point, because the hormones is part of the whole thing. Well, I'm a functional medicine doc, so everything I see is through the lens of hormones, thyroid, immune system, gut, and just basically how that, stress, or otherwise known as hypothalamic pituitary adrenal axis, in other words, cortisol cascade, and how that, plus many other things, system within systems, just literally governs and relates to the whole body. So if something is happening in the body, like cancer, I'm always asking, what else is the underlying metabolic process that we can address on a functional, holistic scale? So while Dr. Leo, for example, is dealing with the active cancer process, monitoring it properly, because proper monitoring is a huge deal.
And can I also just say,
Please.
because I'm in the trenches a lot more,
Yes.
I get to see all the information that you guys do an excellent job monitoring all your patients. We get so much feedback. So we always know what's going on with the shared patients.
The shared patients,
Yeah.
exactly.
So that's, yeah.
The other thing is communications. Communications are the key. Communication is the weakest link in any healthcare system in general. Have you noticed that?
Absolutely. Communication between patient and physician, communication between physicians, absolutely. Because if we miss something, sometimes we cannot go back.
And you can be the smartest person in the room, but if you don't know, if you're not aware of the data, well,
Right, and not only that, sometimes I know, but if I'm not able to impart it to the patient and share with the patient that might be the best approach to achieve longevity and being cured from cancer, if the patient is not convinced and doesn't follow our advice, then all of the knowledge is not going to make any difference. Absolutely.
Thank you. And I'm going to ask you this question as well. There's a lot of fear. There's a lot of hesitation. There's a lot of kind of like knee-jerk reaction, just trying to get answers from all kinds of sources. And sometimes it's confusing. Family, society, different doctors, different opinions. So basically, what's really important is to have a team, a central team. And this is what we have here. This is what I really appreciate about it. Because I can literally call the doc literally on the fly and just say, hey, you could be in the middle of exam room. Obviously, if you can come out, you'll come out. If you can't, you can't. But if we have an emergency or a situation, or if you have an emergency or a situation that you need to tell me about or something, again, I'm available. So and this is one of the best things about something happening in the moment. Address it.
That's true. We've done that with Sergey on several occasions. He has a patient visiting with a serious problem, cancer, and then he gets me on the phone. We discuss the problem, and if it's something that I might be able to help with, we work the patient in very quickly into our schedule to get them in and to get the ball rolling.
So, Dr. Leo, if I had a family member sitting in with Dr. Sorin and we needed to, reach out to you, can you tell us what kind of, like your center, what kinds of cancers do you guys treat?
Great. So first of all, hopefully none of your family members have cancer.
Well, we all have at least one relative, it seems like, but yeah. Right. Okay.
Yeah, and that's the statistics that 50% of males and approximately 35% of females in this country are going to develop cancer in their lifetime. And it's not a skin cancer. Almost all of us at some point may develop skin cancer in our 70s, 80s. But in terms of...
so you treat all types of cancers at your...
Correct.
Okay.
Right.
All types and... Okay.
All types of cancers and blood disorders.
Okay.
Sometimes it does feel like it's too much, but on the other hand, that's very interesting and challenging at the same time.
One thing that I really appreciate about you, and I just want to say for the record, for the folks that are listening, if your doctor is not communicating with you, or if you very frequently I hear, well, I left the office and I have no idea what they said. In other words, maybe it's possible the doctor communicated, but maybe not on the language or to the degree that it was clear to the patient. And again, same thing, back to communications. No communication, well, you got nothing. I want to ask you something here, just speaking of immune system and the immune therapy, because what we do here, and I just want to go into this, intravenous vitamin C and intravenous ozone. So let me kind of go into it and why we do this. And Rachel, of course, you can jump in because this is a huge part of the metabolic support and nutritional support. So intravenous vitamin C is a wonderful compound, and you can give it in doses up to 50, and we've given up to 100 grams, although it's not typical. What it does is it's an antioxidant. It's a free radical, scavenger.
Yeah,
It does
see
so
those
many things. Plus, it's an immune optimizer, and it literally just jump starts the immunity. And this is exactly what you need, because cancer, if the immune system is working properly, your own body should be able to work with the cancer directly. Of course, plus minus help with other agents.
And correct me if I'm wrong on this, because I could be wrong, but my understanding is we often develop little cancers all the time, but our body just kind of, if we're healthy and our immune system's working,
Suppresses
it can
or
deal
works.
with it.
Yeah.
Right. Of course, as of right now, that's what we think. There is no clear-cut way
Okay.
of monitoring it. There is, though, fascinating research that was done at my alma mater at the University of Rochester. There, they would inject mice with cancer cells. And those mice, to begin with, they should have decreased the immune system, because healthy mice are going to get rid of those cancer cells immediately. But there is a certain threshold. For example, they would eject mice with 100 cancer cells. 100 mice with 100 cancer cells each. None of the mice is going to develop cancer. You go up to 1,000, again, none of the mice would develop cancer. You go up to 1,500, no mice develops cancer. You get up to 2,000, 90% of mice are going to develop cancer.
Threshold.
There is a threshold. Below this threshold, our immune system is capable of taking care of those cancer cells, as you said.
That explains something, actually. Because there's a curious case, not a curious, but I mean just interesting, a wonderful case. We had an 80 something year old gentleman, wonderful
Upper
guy,
80s.
upper 80s,
Late 80s.
pancreatic stage 4, literally written off. Just he had an oncologist, not you. It was a different oncologist. It was given. Well, it wasn't even the treatment. I mean, it was just go home, enjoy the rest of your time. He had about 20 IVs of vitamin C and plus 20 ozone intravenous. Ozone is another treatment that we do, and we talked about this. It's a oxygen O3 molecule. Electricity or lightning breaks up O2, you become O3 temporarily, and then it becomes a scavenger for pretty much everything, including whatever doesn't belong in the immune system. And so it then presents it to the rest of the body. In other words, you take the body into almost like a self-transfusion, and then bring it back, and then introduce what needs to be monitored by the immune system. And then somehow the combination of vitamin C and ozone, especially in this gentleman, he was in complete remission. How likely is a stage 4 pancreatic cancer to go into complete remission by itself?
Extremely unlikely. Extremely unlikely. Most of the patients with stage 4 pancreatic cancer unfortunately die. Sometimes with conventional methods, we are able to keep them alive for a year or two. But beyond that, extremely small percentage.
And the quality of life is typically
not very good. Initially, it's terrible quality of life whenever they have to deal with pain, nausea, weight loss related to pancreatic cancer. Then if our treatments work, patients get better, but almost invariably, cancer becomes immune to the treatment, and we have to change to a different treatment, which is less effective. The third line of treatment is even less effective. So it's an amazing story, story.
Thank you. This is why, and again, I'm not going to mention names, but the people that we have in common, the patients that we have in common, have been having a much better outcomes than would be expected. And I'm going to suggest that that's probably because of the fact that they're getting the best of the oncology with the most up-to-date approaches, including but not limited to immunotherapy and otherwise, with the lifestyle, metabolic, but also mental, emotional, and other approaches. And that, to me, that's how cancer should be treated. That's how oncology should be ultimately.
I agree, absolutely. Because cancer, it's the ultimate challenge to patient's body and to all of us. If we don't team up, if we don't all work together, starting from the patient and his family and to physicians and nutritionists involved in patient's care, every aspect is crucial. And yeah, I'll just give you an example. Of course, we talk about the doctor stuff. We talk about importance of the correct nutrition. But with the family, there is research showing that the difference between having no family support and good family support is improvement in survival that actually exceeds some of the improvements that we see with conventional treatments.
Oof. On that end, I'd like to jump in with a holistic concept, and we talk about this all the time. Doc, actually, I'm just going to say this out loud, and I don't know if you'll agree with it or not, but to me, you are a holistic oncologist because you're extremely knowledgeable in the science and the testing. You're communicable. I mean, you talk to people, you care about people. I mean, you spend after hours basically just taking care of folks just to do it right, and you're also open to what we do, and again, we interface. So to me, I would call you a holistic oncologist.
Thank you.
Thank you.
Thank you.
Speaking of being on a holistic scale, the phrase that I use is spirit, soul, mind, emotions, the control center, limbic system. You could say hippocampus. Just so on and so forth. You could use fancy terms, or you can just literally say control center, because that controls literally all the patterns. And then there's physical patterns, including lifestyle, but also diseases or dis-ease or ease, lack of disease. Mental, emotional. What we do is Dr. Shealy has come up with something called autogenic training and biogenics, a program to regulate, just biofeedback, literally, just to calm down, create that sympathetic, parasympathetic adjustment and alignment. And how important, and we'll get to a question in just a second about PEMF. Actually, PEMF is an interesting topic that we've talked about in oncology. So let's talk about just briefly for mental, emotional, and how important that is in your practice.
Right. Many patients, whenever they're in shock after being diagnosed with treatment, of course, it does affect outcomes. Many patients could make decisions about either not pursuing the treatment or stopping the treatment prematurely. But I suspect, as probably all of us suspect, it might also play a role in affecting cancer treatments and fighting with cancer, because there is a lot that we don't understand about how our body and brain work together. And that's why I'm so glad and fortunate to work together with Sergey and Rachel, addressing each aspect of patient's care. So to me, ultimately, everything in our body is governed by our brain and will. And if will is not there, we cannot hope for the best outcomes.
There's a wonderful phrase: if you think you can, you're right. If you think you can't, you're right.
Uh-huh.
I've seen, and Rachel, go ahead, jump in.
Well, no, go ahead and finish what you're. A little bit back to what we're.
Quick, just a quick thing. I've seen stage one cancers literally just go down the basket in very rapidly, just with a poor mental and emotional and just approach. When people give up, it's over. It could be stage one and it's over. You could have stage 4 and you could have a best outcome possible in that situation. But again, it's a lot of well, where's the control center? Please. Yeah.
Well, I was just, so you were talking about the support network and how crucial and important that is. And I saw a little blurb, but I don't know, do you guys offer some kind of support services for families, or is that something you guys?
We do have a social worker.
Okay.
We do have nutritional support, but ultimately there is nothing better than caring family member.
Sure.
That's
Yeah,
love.
that makes,
Yeah.
yeah.
When I was going through my personal situation, in 07, stage 3 colon cancer, basically with lymph nodes and things of that nature. One of the, I'll share a little bit. I was going through a divorce. There wasn't a divorce at that time. This is what led to the divorce, because it changed how I was, and then it changed the relationship, and then it changed everything else. Now, the interesting thing is, when I changed, the relationship changed. And then when my ex-wife, and God bless her soul, she got into depression, very terrible mental state, started drinking a lot. And some point later, about 2 years or 2 or 3 years later, I find out that this beautiful, amazing woman, again, just at that point, it was over, relationship-wise. ended up with a pancreatic cancer and died of it.
Terrible, terrible.
Yep, and I don't think she ever forgave herself or forgave anybody, the situation. So forgiveness, tolerance, and acceptance. Those are huge.
Yeah, agree.
Mm-hmm.
Uh,
Rachel, yes.
Oh no, go ahead.
Well, I just wanted to share something completely shocking to many people if they hear that or learn about that for the first time. More recently, we realized how important is our gut for our overall health and for the immune system. I'll give you an example. Patients who get diagnosed with metastatic melanoma, some of them do great with immune therapy, some of them do not respond to immune therapy at all. And there was some research, I am hopeful you're not eating lunch or dinner right now, that turned it all upside down for us. Patients who did respond to immune therapy had their stool collected, dry frozen, and given in a capsule form, or sometimes if it wasn't dry frozen, given through the colonoscopy as a deep enema into patients also with metastatic melanoma who are getting immune therapy who are not responding to treatment. And those non-respondents to immune therapy, after they got poop from people who responded to immune therapy, many of them started responding. So that is a clear-cut indication that bacteria that live in our gut change the way our immune system works.
Yeah, absolutely. And we see that with weight loss too. The fecal transplants, they can do that, and someone that has an obesity problem, often it will go away. So the gut is huge.
Well, let's come back to the gut, because in a functional, holistic approach, I'm going to talk about the gut as the center of the universe of a human being. Literally, it's the ultimate center, and this is how I see it. This is where it's wonderful to
That's
have.
sometimes how I feel when I'm hungry.
You got it, man. You got it. So this is why gut, to me, the GI is the first question that I ask and they address. It affects hormones. It affects what happens with aromatization, whether conversions of estrogens, progesterones, testosterone. That's literally the organizational structure controlling how the body works. It works with thyroid. It works with the autonomic nervous system, sympathetic, parasympathetic. It has to do with toxicity or lack of toxicity. In other words, leaky gut. It has to do with all these factors. It has to do with SIBO. It has to do with what are you producing? In other words, is it helpful or is it harmful? There's more organisms, trillions of cells in the body, and most of them are actually not human cells. They're in the gut. When the biome is normal, immune system is good. Hormonal regulation is good. Mood, brain, neurochemicals, everything is appropriate. So this is why it's so important to keep yourself in a wonderfully, as much as possible, in alignment, because when something hits you, you can do something about it. Your body will respond. If you can't, it's very little reserve. Please.
Sergey just said something that made me think about the fact that indeed, and some of us don't realize that there are about 37 trillion human cells in our body and about 39 trillion bacterial cells. And as Sergey said, most of them are in the gut. And what Rachel mentioned, whatever bacteria live in the gut may play a role not only in stimulating our immune system, but also in weight management. In fact, there was another type of research that shouldn't be read about during the lunchtime. So there are some mice who are very active and social and lean. And then there are mice who would sit in the corner of the cage and just eat their chow and be almost autistic, not talking to other mice, not communicating with other mice. Now, mice have the ability to eat each other's poop. In fact, not just the ability, somehow they like doing that. So if you put these mice into the same cage, what would happen? They will become more alike. So the overweight mice, the one that is not social, after eating lean mice poop, would become leaner and more social. Isn't that amazing?
That is wild. By the way, just for humans, for people, we're not
It's
advising eating
mind-blowing,
pork,
but
by the
yeah,
way.
no. Well,
But
that's where the fecal transplant.
there's a
Don't
medical
try to do that
procedure
yourself.
that is
Yeah.
done by professionals, and it works. It's wonderful.
But now they identified certain type of bacteria that do modulate immune system and metabolism. And of course, those are early stages of the research. I could share just one research study, if it's okay with you. So it was done in patients with metastatic kidney cancer. Patients were getting immune therapy doublet, which is the best treatment on diagnosis currently, one of the best treatments. And half of the patients received bacterium called Butyricum. It's Clostridium butyricum. Half of the patients did not get it. It turned out that responses to immune therapy were 4 times higher in patients who did get this lonely Clostridium butyricum. And that's just one of the examples. There is plenty of other research. Whenever patients with cancer who get immune therapy, if they get antibiotics or steroids, their odds of response to immune therapy are in single digits, much, much lower than patients who don't get. The fascinating part of the research that was done at MD Anderson showed something completely unexpected. There was another arm of the trial where patients were divided into groups who would get probiotic or not get probiotic. And those were regular run-of-the-mill probiotics that would contain, say, 10 strains of bacteria. Patients who did get probiotics and got immune therapy, they did worse than patients who did not get prebiotics. Isn't that surprising?
Mm-hmm.
It probably has something to do that although probiotics give good bacteria, they change the ratio of many other bacteria, because we have thousands of different bacteria in our gut, and they crowd out maybe some other good bacteria, maybe this Butyricum.
And that's exactly it. It's all about ratios. It's not a question of absolute how many, what's the count of the bacteria. It's basically, are they balancing? Are they balanced? And that's exactly it. And now, Rachel,
Well, and I was just
work
thinking,
with
you
guts.
also need to be able to, you have to be eating the right things to feed and grow the good and keep everything in balance. If you're eating a diet that's not balanced, your bacteria will become imbalanced.
Right.
Yeah.
One of the very basic things that I tell everybody, absolutely every single person, and whether you have cancer, whether you don't have cancer, whether you just have gut problems or otherwise, especially if you do, prebiotic, probiotic, good digestive. I mean, that really helps a lot. A good prebiotic, that's soluble fiber, solemn husk. I mean, things of that nature. 8 to 12 grams. I mean, generally, feed the right bears, you're gonna have the right population. Feed the wrong bears, you're going to have an overgrowth. That's
right.
just
yeah, I love this concept of prebiotics, which we are just starting to grasp over the past several years, because you get good bacteria in your gut, but they're not going to stay there unless you keep feeding them. And what do good bacteria eat? Cellulose. So that's why eating more vegetables, some fruit, is so highly beneficial, because we are sustaining good bacteria in our gut.
Now, Doc,
for the layperson, cellulose is plant fiber. I just break that down, okay?
Now, if this entire conversation that just came out, and just thank you so much, this is brilliant. If Rachel had said that, I wouldn't be surprised, and she's talking about that. But coming from a conventional oncology doc, my God,
we decided he's
he's
holistic.
Now, how does a conventional doc learn the things that you're learning? Because this is not a typical training.
Actually, there is a lot more interest now in oncology to everything that is not directly related to immune therapy, targeted therapies, those novel treatments that we give. Because I'll give you an example. There was a study that came out about 3 years ago at one of the premier oncology meetings that showed what I quoted, that patients who receive antibiotics within 60 days after starting immune therapy, either before or after, their outcomes are much worse. Of course, doctors started looking into that. Why? And they discovered that population of bacteria in the gut changes. And then they started finding out. So actually now a lot of research, and we participated in this, is based on studying the types of bacteria that live in your stool and trying to modify these bacteria. And that what led to the trials that show improved outcomes from immune therapy in patients with cancer.
Let's talk about prevention now, because again, and my God, you've got an.
I love that
Yes.
you're continuous learner, because a lot of doctors
Okay.
I feel like get in a space and they just do what
they
know.
know. Yes.
Yeah, but
Now-
you know a lot of research. So this is a good
Two
yeah.
questions.
Thank you.
Where do you find the time to learn all this stuff?
I don't know. As you know, if you're interested in that, then you are going to keep learning, especially because you know that the buck stops there. If patient has cancer, if I don't know what's the best way to help the patient, then I would fail my patient. So, and that drives me and stimulates me to learn as much as I can.
Yes, sir. Yes, sir. Actually, I was just going to say, we also talked about some other interesting things. The PEMF. Something came up on the PEMF.
You had a question about
There was a
that.
question on
Mhm.
PEMF, and we talked about the PEMF with regard to cancer. Let's kind of talk about that a bit. Now, the question here is: will using more than one PEMF device be extra helpful with cancer healing? Now, that's an interesting question. Let me.
Support, but just just
Oh yes,
yeah.
yeah. Let's just talk about this. What is PEMF? How does it work? Because that's the first question. Because the way we answer it is also very important. PEMF, especially Dr. Shealy model, is based on the fact that it's based on resonance, 7.83 cycles per second, and that's Earth. Literally Earth heartbeat. It's in the atmosphere. Now, if the PEMF is generated 7.83 cycles per second in a device, which is what we do basically, and it's placed next to the person, what it does is it optimizes cellular tissue, optimizes hydration, it optimizes vascular, it optimizes a lot of different factors. So when you optimize the body and the cells, that's the health of a cell, it's less likely to become cancerous, along with, of course, nutritional support, plenty of fluids, mental and emotional, of course. I mean, you can't just use PEMF and expect it to work without using anything else. And what I would say is it's a support mechanism. And again, also when people ask me about the IVs, will the IVs cure my cancer? I'm going to be very clear. We don't cure cancer. We refer to Dr. Leo for expertise. Now, if it happens to be a spontaneous remission or if it happens to be a miracle, we've seen quite a few of those. Great, that's wonderful. But the idea is, if you're dealing with a condition such as cancer, you don't want it to be unknown. You want to talk to the doctor who can actually track, diagnose, and tell us how it's going. Where are the markers? Is it getting better? Is it getting worse? Is it staying the same? Are you responding to what you're doing or not doing? That's the ultimate. But PEMF, you mentioned something about PEMF in oncology.
Right. So let me backtrack a little bit. So in oncology, we do use electrical fields, and that's one of the more recent developments. I would be first to admit that we have no idea about so many processes that are going inside our body, our connection to the outside environment. Of course, we do know that over the past 20 years, there has been rapid increase in the amount of brain tumors. And some physicians and scientists are trying to explain it that maybe it's related to cell phone use, because sometimes brain tumors happen more commonly on the side where we usually keep our cell phone at. There is somewhat similar inconclusive research about increased risk of cancers in patients who live close to high voltage lines. So what is clear from all of that is that humans are reacting to electromagnetic fields. There is just no question about that. There were two really smart guys in Haifa, Israel, who developed a device which uses electrical fields, electromagnetic fields to treat cancers. And this device actually eventually got registered, patented, and now it's FDA approved for using 2 cancers, and more indications are in research and hopefully will be coming in the near future. This device is called Optune, and that's something that triples survival of patients with the most lethal brain tumor, GBM. It triples it. 5-year survival is so much improved whenever we add Optune to regular treatments. Now, similarly, this device has been approved for the treatment of mesothelioma, one of the less frequent cancers in the chest cavity. But it's studied for ovarian cancer, pancreatic cancer, and it is clear to me that there is something there, because we see that from the very rigorous standard randomized trials. I have to learn myself more about PMF, and I'm so glad that Sergey and Rachel know much more about that than I do.
Actually, we haven't talked about that, but as a matter of fact, I have 1 unit for you to take home.
Wow.
As a matter of fact, because I really want you to see what it does for you.
That's very generous.
And if you don't mind that for your people, because we've talked about that, but now that, again, you're busy, I'm busy, we talk a lot, but to be in person. So you're getting a unit to take home.
Well, that's very generous.
Thank you, and I appreciate it. And I would appreciate your feedback on what happens with that unit, especially for yourself as well, because you know what's happening in your body. And so, and then, of course, we can help patients as well, clients. One thing about the PEMF, the concept, the idea that I'd like to mention, the proposal at least, is everything in the body is electromagnetic. Dr. Shealy is famous for creating TENS unit, dorsal cord stimulator. So he's literally an electrical junkie. And then plus, how many, he's got so many devices. It's just, there's scalar, there's PEMF, there is, relax mates, glasses. My God, Dr. Shealy has invented more things that I can mention here in 1 hour. But the idea is, before the cell starts to function on a molecular level, there is a electromagnetic driver for that activity. And that electromagnetic driver, if it's within, there's an expression, it depends on which range you use, let's say minus 70 to minus 90 millivolts across the cell surface. If that cell surface is now less voltage or more voltage, that cell is not healthy. That cell cannot use the calcium, all the exchanges, calcium, magnesium, potassium, in other words, all these elements, all these things that have to flow in and out. You lose the control of the membrane, you lose the control of the function, and then the cell starts functioning substandardly. And especially what happens is, and again, please feel free to jump in, especially on your end, because you see this a lot more than I do. You throw in terrible lifestyle, stress with your hypothalamic pituitary adrenal disorder, in dysfunctions, cortisol, fight or flight, circadian rhythms being off, all sorts of stuff. And then next thing you know, you get cancers. Any thoughts on what you see with your clients? And
I mean, a lot of times by the time they come to me, they've spent years, unfortunately, doing a lot of cellular damage. But the cool thing about our bodies is we do know how to regenerate a lot of it.
This is what
with the right stuff, with the right tools. Yeah.
And I don't want to say that, I want to take Rachel's words and I want to make it very, very clear what we're saying. Every 10 to 12 years, say, every cell in the body is going to be a turnover. So that means whatever the pattern you put in, whatever the patterns you continue, reinforce, that's the outcomes you're going to get. So if we're doing the healthy, good stuff and you're coming from a terrible place, you're going to get healthier, even though you get older. And if you do terrible things and you're young, well, you're going to get old really fast. So,
of course, we haven't touched as much on the supplements that could be helpful both in fighting cancer and probably even more important in preventing cancer.
Yeah.
More recently, over the past 10 years or so, there has been a new concept that Sergey was referring to of cells in our body that are not functional, not active, but not dying. They are called senescent cells in medical language. A colloquial name for them would be zombie cells. So they don't do anything good, and they could inflict a lot of damage, increase inflammation in the body, and inflammation, of course, could drive heart disease, cancer, all of the other problems.
Actually, from a functional medicine perspective, just last year I went to three holistic conferences, basically on everything from hormones to thyroid to regulatory stuff in the body to chelation to just everything. And the key word for this in the coming up century: inflammation. Literally. Yeah.
I like that you backed it up though, so they understand that it's the senescent cells that are part of that problem. Yeah. So you have specific supplements that because I know we were talking about supplements, or who wants to take that?
I'll take that. Okay. So all right, I'll run with it. But feel free to jump in, Doc. You're a wealth of information. My God, it's actually the Encyclopedia Britannica, so to speak. Of there's such more thing remaining.
It's funny, yeah.
But okay, so you got to have a basic, and please feel free to weigh in on this. Okay, so this is what I tell people at the very basic. If you do nothing else, a good B complex, because that's literally the fuel for the cell. 25 to 50 milligrams of B. Otherwise, you just not give. It's like a car without a fuel. You can't expect it to run. And if it doesn't run, well, that does other things that are not good for you. Vitamin C with a combination of MSM, Dr. Shealy's youth formula. And this is what we use at 4 per day if you're over 130 pounds. So that combination raises DHEA as well, not just decreases free radicals and helps with inflammation. And raising DHEA balances the cortisol. So cortisol goes up, DHEA balances.
I want to back up a little bit. I want to hop in with the vitamin C. So vitamin C is really important. Something people don't often think about is that vitamin C and essentially sugar, they compete for the same cellular protein channel. Yeah. So if you're eating a whole bunch of sugar and taking a whole bunch of vitamin C, I don't know which one's going to get in there first. So it's really good
back to diet.
Yeah.
So that's why you get into the basics and you get into yes. Yeah. You've kicked my butt.
Yeah. Well, and just fun fact for anyone that has like a glucose monitor or takes their blood sugar, if you've taken a high dose of vitamin C, it will show that your blood sugar is through the roof. It's not your blood sugar.
That's it's a molecule that looks almost similar. Yeah. So actually, a couple of things that I did want to say. So the PEMF. So just to again, it's not going to cure cancer, but I would certainly use it if you can, because I mean, if you can optimize body tissues, my God. Now, whether using 2 PEMFs versus 1, now that may be helpful. Again, we haven't done the research, so just can't say that. Dr. Shealy uses 2 PEMFs all the time, but again, that's all I can say on that. Yeah.
So we're kind of running out of time, and you're an amazing resource. So I see we've posted the link for the cancer.com.
I'm not sure whether it's the correct link. It might have been one of the links for virtual appointments.
Oh, can we, so he can look at it? Can you click on that so we can make sure, or just the actual, well, I meant so he could see that on the tab. Yeah. Is that the right one? That is for making appointments, isn't it?
That's for virtual appointment. But I guess there is some information there from several years ago. But we are located in Bolivar. The name of the private cancer center, it's actually not affiliated with Cox or Mercy or the hospital that's located in Bolivar. The name for the company is Central Care. And our contact phone number is 417-326-7200.
Well, let's type that in there. So 417-326-7200. Perfect. Thank you.
And
if you just let I guess if you have a question or concern, if you need to get in to see Dr. Leo, if you want a comprehensive, holistic perspective, I mean, we work together extremely well. And I would suggest for anyone who's got cancer concern or diagnosis, or they want a second opinion, literally, if that's where your gut feeling is, check it out. It's good resources are worth it. Yeah. If we have a few minutes, actually, just I do want to mention, we have Several great resources as well here in town. Tart cherry juice concentrate, wonderful, especially if people don't get their veggies in, because veggies are the antioxidants. This is what keeps us from having cancer to begin with if we do it right. So
that's the Coloma tart cherry juice.
Coloma tart cherry juice, Dr. Shealy's favorite.
And then you can find many of the supplements we talked about at Spring Valley.
Oh, absolutely. And we're talking basically Dr. Shealy's youth formula, essentials, but also vitamin D, magnesium, bliss oils. And of course, you can find many others. And this is Spring Valley. Great, great place, great service.
And then if you want to follow us, so, we can share all this cool information, you can follow us on Facebook, Instagram, or subscribe to us on YouTube.
And so we can keep bringing you amazing, great people such as Dr. Leo.
Yeah, thank you
so much for inviting me.
Thank you for being
it's a
here.
great
It was really
pleasure.
great.
Thank you. Appreciate it.
Thank you.
And thank you so much for the opportunity to share some of the stories and information.
I do want to finish with a closing thought. Having been through cancer, my wife right now, that's she's been through cancer. I know a lot of folks who have been through cancer, including our patients, clients. There's hope. I'm just gonna put it there. There's hope. As long as as long as in your mind, you want to win, you want to succeed, you want to optimize, you're going to do it. And you're going to do it by working with folks, with doctors such as Dr. Leo, ourselves, and literally put in your mind the outcome that you want. And then let's get there, if possible. All right, take care.